Rugby is a physical game in which two teams of 15 players compete on a rectangular field using an oval-shaped ball. The sport, which originated in England, has become a cultural phenomenon in Australia and is one of the 4 football codes played. With little protective gear, teams compete in a highly physical manner to score the most amount of points through tries, field goals, and penalty goals. Since the sport became professional in 1995, improved conditioning and diets, as well as players tackling higher up on the body instead of the legs, has made the game involve more high-speed collisions. These collisions often result in head injuries and concussions that can prove fatal if left unrecognized or ignored. A concussion is a head injury caused when the skull either accelerates or decelerates rapidly after being slammed into the ground or struck with a blunt object. While typically concussions occur due to a direct blow, they can also be caused by whiplash. When a person sustains a concussion, their brain, which is cushioned by spinal fluid, rattles against the skull, leading to bruising and causing chemical imbalances in the brain. The Australian Rugby Union advises the rugby public to follow a standard care pathway for the management of a concussion. It lists a number of steps to be followed after a player is removed from the field. Each step must be completed before proceeding to the next step. The main steps are to recognize that a concussion has occurred, recover the player from the concussion, and then return the player to the game. During a game, an injured player will first be met on the field by a trainer who will look for signs of a concussion. Symptoms indicating a concussion include dizziness or lack of balance, loss of taste or smell, nausea or vomiting, persistent headache, prolonged memory loss, ringing in ears, slurred speech, or vision disturbances. If the trainer suspects signs of a concussion, he will escort the player off of the field to be immediately seen by a doctor. The doctor will review footage of the injury and then examine the patient directly to determine the severity of the injury. Once upon a time, it was seen as an act of bravery for an injured player to return to the field. Now it is seen as completely reckless, as more serious issues like bleeding in the brain or skull fractures can mimic signs of a concussion. Additionally, post-concussion, a person can experience anxiety, depression, fatigue, insomnia, irritability, lightheadedness, trouble concentrating, and sensitivity to light and noise. World Rugby also follows a 3-step process to diagnose or rule out a concussion within 48 hours of injury. HIA-1 is a pitch side assessment of the head injury. HIA-2 is a follow-up which is conducted within 3 hours of the injury. Finally, HIA-3 is a cognitive assessment using neurocognitive assessment tools and a balance evaluation.
Rugby has a particular issue with concussions and other head injuries, as players are largely unshielded. Some players choose to wear mouthguards and soft-shelled head protection, but their effectiveness in preventing concussions is controversial. The lack of protective gear used leaves rugby players susceptible to violent acceleration and deceleration and rotational forces. About 1,200 people suffer head injuries while playing rugby each year, costing the league more than $2 million to care for these injured players. A 2013 study of sport-related concussion in Victoria demonstrated that the reported number of concussions per year is a gross underestimate of reality. The report suggests that the vast majority of concussions were likely going unreported and untreated by doctors, with the actual number likely to be 6 to 10 times higher than the official figures. One incentive not to report is that the International Rugby Board has ruled an automatic 3-week suspension from all competitions and team practices to any player who self-reports or is diagnosed as having a concussion. As a result, players choose to keep quiet about their injury to continue to play. This is a serious issue, as there is a very strong case for a link between repeated head trauma and impact and brain injuries such as Alzheimer's disease, Parkinson's, dementia, and CTE.
Well, they're off again from deep. taken by Pickamole. Defiant trying that defeat to the All Blacks last weekend in Paris.
Oh, he's an outstanding carrier, and he just bought time there. He had 3 or 4 men on him and was still going forward, giving his fly half a full ball to kick off.
North needs to be careful, and so does Thompson, and Burrell comes in and makes it clear what he thinks.
Lots of attention was drawn to concussions in December of 2016 after an English rugby player, George North, was knocked unconscious after being tackled but was allowed to continue playing in the match. He was administered a head injury assessment and deemed fit to play, but the issue was that he was unconscious directly following a collision, so he therefore should have been taken out to sit on the bench. World Rugby's Recognize and Remove protocols state that any player displaying clear or suspected signs of loss of consciousness should be permanently and immediately removed from the field of play. A head injury assessment isn't even supposed to be administered. The team was not administered any consequences after an investigation into the incident was conducted, though on the world stage, many teams and players are calling for a more strict policy when dealing with head injuries. The topic of protective gear in rugby has been widely discussed. Some doctors maintain the stance that requiring players to wear helmets will cause more injury because the players will feel more comfortable to throw their bodies around without risk of being hurt. Another standpoint is that helmets don't protect against concussions because they do not stop the whiplash effect of the impact of force, which is where many concussions stem from. No helmets have been approved to be used in rugby union in order to prevent concussions thus far. In comparison, in other contact sports, such as in the NFL, the players are decked out in huge pads and helmets to protect the players. Many call on this example for arguing for protective gear in rugby, but the sports are specifically different in regards to tackling. In rugby, the trick to tackling is to go low, hit with the shoulder, keep your head up and to the side or back of the opponent, grab with your arms and hands, and then get back to your feet to try to steal the ball. This tackling technique specifically protects the head, which could be a reason that rugby has not had nearly as many concussions issues as the NFL.